Good evening to you all. This is Veer Maheshwar Charitable Trust Latur organizing every day the international webinar series. In this series, every day we are listening from the participants, sorry, resource persons. Every day, new resource person and new topic, and they are invited from all over India and abroad, few from abroad. In this series today, we have invited Dr. Shalini Chahande Madam, who is Professor and Head Department of Biochemistry, Seth Kesarimal, Porwal College of Arts and Science and Commerce, Kamptee, Nagpur. Her topic is nutrition and diabetics. As you are aware of that, this series covers the topics related to our education, health, law, environmental, social issues and health problems. So, today this topic is related to our health, nutrition and diabetics. So, I welcome today's resource person Dr. Shalini Chahande Madam and all the participants, those who are joined here. I request today's resource person start her speech by introduction of herself on the educational activities, research, awards, and then you can start our regular speech. Thank you, ma'am.
Thank you, sir. Thank you, respected BETKAR, sir. This is a platform where you give opportunities to all the invitees who can speak on various aspects from various backgrounds. Respected BETKAR, sir, and the organizing team who are taking part. I'm very glad that you are doing this because earlier also I have participated in the series which you have already organized. So I think this is the second series of lectures. So myself, Dr. Shalini Chahande, professor and head at Department of Biochemistry, Seth Kesarimal, Porwal College, Kamptee. I have 25 years of teaching experience and also engaged in research. I am a research guide as well as I have done research in various fields. My actually area of interest is immunology, covering various aspects in it. Also, I am Board of Studies member at Nagpur University, Nagpur, as well as LIT, which has become an autonomous institution. There also I am a member of Board of Studies. So I think this short introduction of myself is enough for today. Today we are diving into a very interesting topic because nowadays what we are hearing from each and everyone is that India is becoming hub of diabetes, because every 1 person in 10 says that he or she is having symptoms. Actually, they are not aware that they are having the symptoms of diabetes, but this is need of an hour that they should know what actually diabetes starts and what are the precautions. Without going into it, how can we prevent ourselves from getting it? So I think this is the and diabetes along with nutrition, because they are very related to each other. If you follow good nutrition, then you can keep diabetes at bay. There are certain types of diabetes where you cannot do anything with it, you have to live with it. But type 2 diabetes, I'll explain what different types of diabetes are and also what is the nutrition required for certain types of diabetes. Let me share the screen. Yeah. Diabetes and nutrition. Today, consumption of healthy food every day is highly recommended to meet daily nutritional needs. Now, this is with respect to everyone, but we are today talking about the consumption of healthy food in case of diabetes. So, first of all, I would like to elaborate more on it. Actually, the screen has frizzed. I don't know what has happened.
If there is problem, you can share with me. You can share PPT. I will show from here.
Yes, sir. I'll share the. Sir, is it visible? Hello.
It's visible. Yes, it's visible and changing also. You can
Okay.
continue.
Okay, sir. Yes, sir. Yes, sir. Now, why is nutrition important in disease states? Now, we are talking about diabetes and nutrition. So, why the nutrition is important not only in case of diabetes but also in case of other diseases? Because what happens during illness, whatever the metabolic demands of the body are, they are often increased, and we require additional energy so that we can sustain the disease state. So, essential nutrients, in which the important ones are the proteins and the other nutritional requirements to support the immune function, because the body is diseased, so you need to improve it with the proper functioning of your immune system, as well as the tissue repair and the overall healing of the that particular state of disease. So if you don't have proper nutrition, what will happen? If proper nutrition is not there, then the immune system will weaken, and there will be delayed recovery, and again there might be complications related to that particular disease. So for this purpose, a tailored nutritional support. Tailored nutrition support means what? You have to think mindfully what to eat and what not to eat. For this, the nutritionist also helps you, as well as the doctors, they also tell you what to eat and what not to eat. So this tailored nutritional support helps maintain strength. It improves your treatment outcomes, because so many medicines have been given. So those medicines, they what they do is the energy requirements in case of particular disease, it increases or decreases. So looking at that, what you have to do is you have to choose a proper nutrition which will enhance the quality of life, and the total healthcare will be improved. Now we are coming to what is diabetes, because we are discussing nutrition in terms of what the nutritional requirement of a diabetic person should be, or before going into diabetes, what a person should do. So now diabetes is a disease where the amount of sugar in the blood becomes too high. So there are reasons why the glucose or the sugar in the blood becomes too high, that also we will discuss. Normally what happens, our body uses sugar from food for energy. Now whatever we eat, it provides us sugar, because major chunk of the food which we eat comes from the carbohydrate. In Indian food, what we see is major portion is carbohydrate, and the other things are proteins, fats, vitamins, and minerals. So because major portion is carbohydrate, that means we are taking lots of sugar. But in diabetes, this sugar stays in the blood and causes problem. This sugar should not stay in your body, and what the body has to do is the body has to get rid of this sugar. So what we do is we eat mindfully so that this sugar doesn't stay in your bloodstream. Why does diabetes happen? Now this is a good question, why this happens. So what happens when we eat food, it turns into sugar into our body. So in every food, in carbohydrate the amount is more, while in some food which we don't label them as carbohydrate, but still the sugar is present, little in amount, but still sugar is present in it. Now in our body, one organ which is called as the pancreas. So a hormone called insulin is secreted by the pancreas. So a hormone insulin helps move this sugar from the blood into the cell for energy. So this hormone is very, very essential for us. In diabetes, what happens? Either the body does not make insulin. So when the body does not make insulin at all, we call that particular diabetes as type 1. And when the insulin doesn't work, though it is being produced by the pancreas, but it does not work, we label that disease as type 2 diabetes. And so sugar keeps increasing in the blood. So whatever may be the reason, may it be a type 1 or may it be type 2 diabetes, but the sugar keeps on increasing in the body. Now, these are the types of diabetes mellitus. Number one is type 1 insulin dependent diabetes mellitus. Now, this second type is insulin independent diabetes mellitus. It is called as NIDM. And one more is there, which we call as gestational, which occurs in pregnancy. Now, this type 1, what is this type 1 diabetes? Now, it is an autoimmune disease. What is an autoimmune disease? First of all, we need to know what is an autoimmune disease. Autoimmune disease is nothing but when our body, which otherwise fights for us, the immune system which is present in our body protects us from diseases. And suppose if one's body does not recognize whatever the proteins or carbohydrates or the other things which are present in the body, they are recognized as foreign. And if our body itself fights against it, they are present in our body, they are host to our body, body should not recognize them as foreign. But in autoimmune diseases, what happens? The body does not recognize them as their own and fights against them. And because of this, autoimmune diseases occur. So in type 1 diabetes, autoimmune diseases, here the immune system attacks and destroys the cell in the body that produce insulin. So the production of the insulin is hampered in type 1 diabetes. So the rate of what we are seeing nowadays is type 1 diabetes is rising worldwide, with the greatest increase occurring in the children younger than the age of 5. This is alarming because it is type 1 is increasing day by day, and it is found in the children younger than the age of 5. So this is very alarming. So in people with type 1 diabetes, the body does not make enough of the hormone insulin. So that is why the body, which enables the body to convert glucose. Now here, this insulin is a very important hormone which converts the glucose into energy in the form of ATP, we can say. So this is very important, and this is the primary thing which occurs in our body when we eat food. And this, if this does not happen, what will be the body state? We can imagine. So type 1 diabetes develops when the insulin producing beta cells in the pancreas are destroyed due to an autoimmune process in which the body's immune system mistakenly destroys its own organs or tissue. So in this type 1, the autoimmune process starts and the body mistakenly destroys the organs or the tissues. The onset of the symptoms can happen quickly. So as soon as this happens, we can get the symptoms of diabetes. Then type 2 diabetes, which is very common. Type 2 diabetes is a metabolic disorder. Now see, the earlier one, type 1, is an autoimmune disorder, while this, we call it as a metabolic disorder. This metabolic, what is metabolism? Metabolism is nothing but the, it's a process in which the body either synthesizes at a time, either it will synthesize or it will utilize whatever is being produced. So this is called metabolism of the body. So whatever food we eat, it undergoes metabolism, catabolism and anabolism, we say. In catabolism, the food is broken down so that we get the energy. And in anabolism, the food is synthesized so that again we get the energy. So whatever metabolic processes takes place in the body, it is only for the energy. So in case of type 2 diabetes, that results from the body's inability to make enough insulin or to properly use insulin. So either the body is unable to make insulin, or If insulin is at all produced, the body cannot use that insulin. This is that state. So type 2 diabetes is the most common type of diabetes in India. In type 2 diabetes, the pancreas produces enough insulin. Now the pancreas has the ability to produce the insulin. This is in contrast with type 1, where the insulin is not produced, or insulin is being destroyed, but here the pancreas produces enough of the insulin, but the body cannot use it effectively. This is referred to as insulin resistance. So earlier, this insulin resistance was limited to the professionals who were knowing what diabetes is. But nowadays, I think because of the use of or overuse of the social media, many of us know what insulin resistance is. So here, if insulin is at all produced, but if it is not utilized, then we call it as insulin resistance. So gradually what happens? The insulin production slows down, because what body does is body protects us from everything. If the body sees that enough amount of insulin production has been done, then the body shut off that particular mechanism, so that no more insulin has to be produced. So it's a natural process. So in type 1 also, this the same thing happens. Because of autoimmune immunity, the insulin is not producing, and here whatever amount of insulin is produced, it is not being utilized. So body recognizes that whatever amount is needed is present, so asks the pancreas that now no more production of insulin. So actually previously it was unheard that the children and the teens, they do have type 2 diabetes, but it is now being diagnosed more often in children and teens, which some research links to increasing rates of child obesity. And why child obesity is occurring? Child obesity is occurring because of the bad food habits. Nowadays, the people or the children, they are jumping to the fast foods, and fast foods, they give you more amount of fats, and obesity occurs. The third and very important type of diabetes is called as gestational diabetes. This gestational diabetes develops during pregnancy. So, when a hormone made by the placenta prevents the mother's body from using insulin effectively. Here, what happens? The placenta prevents the body to utilize whatever the insulin produced by the pancreas of the mother is not utilized. So, what happens? It is not caused by the lack of insulin, but by other hormone produced during pregnancy. Because during pregnancy, there are other hormones to maintain the pregnancy, or the health of the uterus. There are various hormones which are produced in the body, and these hormones, in turn, in some ladies, they cause the body not to use that insulin, so that can make insulin less effective. Gestational diabetes symptom disappear following delivery of the baby. This is short term. So whatever the mother is experiencing during her pregnancy, whatever the symptoms of the diabetes, which we call as gestational diabetes, they go when the baby is being delivered. In the condition called, now see, we have discussed gestational diabetes, type 2 diabetes, and type 1 diabetes. Now, whenever we are having, see, type 1 is not that common. We focus more on type 2 diabetes. Now we come to the condition which we call as the pre-diabetes. Now in pre-diabetes, that is when the person is going towards having the disease called diabetes, we call it the condition pre-diabetes. Here, the blood sugar level is elevated, but not to the degree that constitutes diabetes. So what we do generally do is we go for blood test, and in the blood, if the sugar level is elevated, but there is a value, normal value, it doesn't fit in that normal value, it is slightly elevated, we call it as pre-diabetic state. So people who have repeated tests showing elevated fasting blood glucose level. Now nowadays, whenever we suffer from infection or any disease, doctor first of all asks us to do fasting blood glucose, random glucose, and test for the blood sugar. So what happens if once you get positive test or elevated blood glucose, then doctor suggests us to repeat it again and again, so that we get the confirmation whether we fall in pre-diabetic state or normal or in diabetic state. So elevated fasting blood glucose level have increased risk of developing full blown diabetes. So that particular number, we say that 120 and below 120, the sugar amount below 120 will be having a normal value, and the people is not labeled as being diabetic. But above that value, if we are falling above that value, then we call it as diabetic. So if the amount is elevated and continuously we are getting the blood glucose level elevated, then we can say that we are in the focus of getting the diabetes. So those over age 45 should be tested for pre-diabetes or diabetes. If a first blood glucose test is normal, individual should be retested every 3 years. So it is mandatory nowadays that we should go for the sugar testing. Those under 45 should consider testing for pre-diabetes or diabetes if they have a body mass index BMI greater than or equal to 25 kg meter square, and have several risks such as sedentary lifestyle. Now, why this happens? Those below 45, see, these terms are related to each other: your age, your body mass index. So if the body mass index is more, then the people are more towards developing diabetes. So in such cases, there are risks, like some people, they have sedentary lifestyle. That means they are not doing much exercises. Exercise means what? They are sitting at a place, like IT professionals, they are every time sitting and doing their job on the computers. So we can label it as a sedentary lifestyle. So every half an hour we should get up and move, so that the body has the circulation proper. Certain medications, including some antipsychotic, steroids, diuretic medicine. See, antipsychotic drugs, they are being given in some forms of mental disorders, as well as in case of depression or anxiety or such diseases. So those people, they are also in the umbrella of developing diabetes. Then steroids. There are certain diseases, like, or in case of autoimmune diseases also, and certain skin diseases, then certain other diseases where the doctor prescribes steroids. If the person is on steroids, then that person is also has also certain medications, including some antipsychotic, steroids, diuretic medicine. If the blood pressure is high, the doctor prescribes us diuretic medicines. So if the person is on diuretic medicine, they are also having the risk of developing the diabetes. And one more very common reason for it is having a family history of the disease. Now, diabetes. What are the diabetes symptoms? Diabetes symptoms, they can cause too much glucose in the blood or too little. So there are two consequences: either too much of the glucose or too little. Now, problem with blood sugar regulation due to diabetes can cause what? Headaches. If the regulation is not proper. If it is too much, then also it's a problem. If it is too less, then it is also a problem. So because of this, either you will have headaches, increased thirst, frequent urination, increased appetite, weight loss, blurred vision, fatigue, dry mouth. So these are the symptoms. Now, here, numbness or tingling hands or feet, wounds that won't heal, then vaginal infections, problems having sex, blurry vision, sudden weight loss, constant hungry, and always thirsty. So these are the symptoms which we feel, and because of which we can come to the conclusion that we need to test our blood glucose level. So whenever a diabetic person is having blood sugar more, what happens? He is in a state called as hyperglycemia. Hyperglycemia is nothing but high blood glucose. Now, diabetes is characterized by failure to secrete enough insulin. So this particular condition where high blood glucose is there, because the glucose has not been utilized by the insulin. So the metabolism of glucose has not taken place. Hypoglycemia is characterized by what? High blood glucose level, that is either too high or too low. To fuel the body's normal functioning, we need sugar level, because we know that the only food which brain has is glucose. So glucose should be there in the body, but it should not be very high. So hypoglycemia is a condition, maybe a condition by itself, a complication of diabetes, or a sign of another disorder. Hypoglycemia is when the body has less amount of glucose in the blood. So I already told you that diabetes can be of high, the insulin level will act in such a way that blood sugar level is too low or it can be too high. Why is diabetes dangerous? Because diabetes, if it is not controlled, it can damage important body parts. Eyes, it can cause blindness, which we called as glaucoma. Then kidneys can stop working. Fit wounds may not heal and get infected. Heart, risk of heart attack. Then there is a increased risk. Then nerves cause numbness or pain in the hands and the feet. These are the very dangerous. Now, type 2 diabetes is most common diagnosed by diabetes, accounting for 90% of all the cases in the world. So primary indicator of type 2 diabetes is insulin resistance. This is a very important factor. What is insulin resistance in type 2 diabetes? When the body cannot fully respond to insulin, though insulin is there, but the body cannot respond to it. In many cases, the condition can be delayed or prevented. So it is in our hands. We can delay this or we can prevent it. Now, I already told you that risk factor for diabetes, that family history of diabetes is there, overweight, those who have much of the weight, then unhealthy diet, physical inactivity, increasing age, high blood pressure, ethnicity. Now, here earlier I said that in India it is becoming hub of diabetes because it comes under ethnicity. Why the Indians are getting more and more diabetes? There are certain reasons, because we are not following proper diet, and the environmental conditions are such that we are being going towards having that particular disease. Impaired glucose tolerance, history of gestational diabetes is more nowadays, and poor nutrition during pregnancy is also one of the reasons for gestational diabetes. Continuous glucose monitoring should be there. So nowadays there are the pharmacies are being flooded with the glucometers, where you can have that instrument, and at home you can monitor your blood glucose level. Diabetes and physical activities, they are very much interrelated to it. Aerobic exercises will boost your cardiovascular health, that is your heart. So for that, walking, swimming, cycling, these are the things which will help you from getting diabetes. Then strength training, enhancing insulin sensitivity. So resistance should go, and the body should be sensitive for insulin. Flexibility and balance, reducing injury risk. So practice yoga, pilates, and valuable additions to diabetic friendly exercise routines. So you will get plenty of them if you search the social media. So these activities promote better posture and joint flexibility and help reduce the risk of injury, which is particularly important for people with diabetes, because if they get wounded, then the wounds, they don't heal, and therefore flexibility should be there. So people who may be prone to foot and nerve related complication, they should practice this flexibility and balance, so that it reduces the risk of injury. Now we come to our main topic, which is diabetes and healthy nutrition. So, for those people who are living with pre-diabetes or diabetes, a healthy and balanced diet that include all major food. It is important to keep blood sugar level within the target range and delay or avoid diabetes related complications. So, the important thing which we should know is the glycemic index and the blood glucose. Now, what is this glycemic index? Glycemic index is nothing but how quickly food raise blood glucose level. See, what if we eat sugar? Sugar means if we eat fruits. Fruits, they contain much amount of fructose in them. Another form of sugar. It's not directly glucose; it's fructose. So what happens whenever you are taking the food rich in sugar, the glycemic index of that will be shown in your blood sugar level, which you will check. The same thing happens when you are taking the food, like if you are eating wheat roti, and if you are taking a jawar roti. Jawar roti will have the rise of blood glucose level less as compared to the wheat roti, which will give you rise in blood glucose level more. So we can say that glycemic index of wheat is more as compared to jawar. So low glycemic index food are digested and absorbed more slowly. So if you are eating jawar roti, it will be digested and absorbed more slowly, causing a slower, more gradual increase in blood glucose. But if you are taking high glycemic food, then it will be digested and absorbed quickly, causing a faster and more amount of blood glucose level will be increased in the body. Examples of low glycemic index food include some fruits and vegetables, plain milk without sugar, nuts, legumes, pulses, whole grain cereals, and whole grain bread. For people with diabetes, this is recommended that they should take food which has low glycemic index, so that it reduces the insulin demand and help manage the blood glucose levels. Now, tips for a healthier diet: what should be consumed and what not should be consumed. Now, here, choose water, coffee, or tea instead of fruit juice. We have the habit that we feel that fruit juices are good for health. But if the person is pre diabetic or diabetic, then they should avoid this. Instead of fruit juice, soda, or other sweetened beverages, we should prefer water, coffee, or tea, coffee and tea without sugar. Eat at least 3 servings of vegetable every day, because vegetables, they has got uh, fibers in them. Green leafy vegetables, fiber rich, so that absorption happens properly, and it will help you in long term. Eat up to 3 serving of fresh fruit every day. Choose nuts, a piece of fresh fruit, or unsweetened yogurt for a snack. So if you have the habit of snacking in between the food, then you should prefer the nuts or fresh fruits or unsweetened yogurt. Limit alcohol intake to a maximum of two standard drinks per day. Choose lean meats of white meat, poultry or seafood instead of red meat or processed meat, because lean cuts of meat, poultry or seafood, they have less amount of fat in it. Then choose peanut butter instead of chocolate spread or jam. Choose whole grain bread, rice or pasta instead of white bread, rice or pasta. We say that avoid white colored food. That's it. Choose unsaturated fats. So whenever you are using fats, the fats should be in the form of like olive oil, canola oil, corn oil, or sunflower oil, because they has got more amount of unsaturated fat instead of the saturated fats like butter, ghee, animal fat, coconut oil, or palm oil. These are to be avoided. It is very important for us to balance the micronutrients. So the foundation of the diabetic friendly diet is built up upon nutrient dense whole food. It should be complete with the nutrients which are required for the body. We call them, if it is the body is having the food which is complete in itself, the whole food. These food provide essential vitamins, minerals, antioxidants. If we take the nuts or fruits or vegetables, we will get enough amount of vitamins, minerals, and antioxidants, reassuring that you are making the best choices for your health. And for that, I already told you that we should be dependent on these foods. A well designed diabetic friendly diet contains a good balanced amount of micronutrients, where you should have a proper or an optimum amount of carbohydrate, protein, and healthy fats. Now, these micronutrients, they have an impact of on the body or on the blood glucose level. So, the people who are having diabetes, they should eat mindfully, making informed choices to manage their condition effectively. Carbohydrates are the primary micronutrient that directly affects the blood glucose level. So we should mindfully choose which carbohydrate has to be taken in the food. So people with the diabetes or pre-diabetes need to count and control their carbohydrate intake. So I would suggest that those people who are having diabetes or pre-diabetic condition, they should avoid the wheat and rice directly. They should switch themselves to the millets like ragi, or we can say this bajra, jawar, like food, so that they are graded under the low glycemic index food, and they will give you lesser amount of blood glucose level increase, and sensitivity of the insulin resistance will go off, and will become sensitive. Focusing on complex carbohydrate. So these are the complex carbohydrate which I told you the list. Fiber rich low glycemic carbohydrate are absorbed more slowly and have a lower impact on blood sugar. So the amount of carbohydrate we eat will affect our blood sugar level. So managing carbohydrate intake, this means portion control. What amount is needed, only that amount you should take. So like if you are eating three rotis earlier before you had the diabetes, now you switch on or curtail your rotis to one. This is portion control. So carbohydrate intake is important to keep this level in range. So we have to curtail the portion amount. Instead of carbohydrate, incorporate such food which does not cause blood sugar level to increase. This means matching insulin to the amount of carbohydrate consumed. So whatever amount of insulin is present in the bloodstream, that amount of carbohydrate needs to be taken, so that both of them take care of each other. Vegetarian diet, this is very much practiced everywhere. Vegetarian diet or better diabetic management. What is vegetarian diet? A vegetarian diet or vegan diet rich in whole grains, fruits, vegetables, legumes and nuts. What happens, this particular diet which is rich in whole grains and fruits, vegetables, they often are used to manage diabetes and prevent, even reducing or eliminating the need for diabetes medicine. So the people who are having diabetes, they can manage their diabetes in such a way that if they eat mindfully, then they need not take the medicine. So research suggests that plant-based diet can improve insulin sensitivity. So if someone is in the umbrella of insulin resistance, then they should follow the vegetarian diet, so that the improvement in the insulin sensitivity will come, which will contribute to their weight management, and it will reduce the risk of type 2 diabetes by up to 35%. Vegetarian diet also has higher fiber content, and therefore it regulates the blood glucose level. It has got abundant of antioxidants and phytochemicals which provide additional health benefits. Avoid sugary drinks, fruit juices when thirsty, because these can cause spikes in blood glucose level. Spikes are very dangerous. Sudden increase in blood glucose level is very dangerous for us. So we should try to avoid the number of time. If your blood glucose level increases, then that will be more dangerous for you. However, sugary drinks can be helpful when treating hypoglycemia. What happens? Some people are on medicines, and because of that medicine to cure diabetes, that person goes into a hypoglycemic state. Hypoglycemic state means what? The blood glucose level is too low, and in that condition, that person will get the symptoms. For them, it is advisable to have sugary drinks. So instead of sugary drinks, choose water or sugar free drinks, tea and coffee, for those who don't have hypoglycemia and they are in the hypoglycemic state. So portion size, I already told you, and meal timings, they are very important. So achieving and maintaining a healthy body weight is crucial in diabetes prevention and management. First and foremost thing in management of diabetes is you should be after maintaining your standard body weights. Even modest weight loss can significantly improve in insulin sensitivity and reduce the risk of developing type 2 diabetes. So if we see that we are getting the symptoms of diabetes, that is type 2 diabetes, and if our weight is alarming, then we should focus on losing the weight, so that insulin sensitivity can be had. Portion control or consistent meal timing are part of maintaining stable and blood glucose level. Now, this is very, very important. When you are taking your breakfast, when you are taking your lunch, when you are taking your dinner, those timings should be maintained. Every day, you should take the food at that particular timing. Haphazard eating should not be there. Additionally, intermittent fasting can offer promising benefits for diabetes management and prevention. Nowadays, people are following this intermittent fasting. In intermittent fasting, if you are eating there are various regimes for intermittent fasting. Some people, they follow intermittent fasting for 12 hours, 14 hours, 16 hours. Some people, they even fast for a day. So it depends on your condition how you can manage that. But 12 hours, I think everyone can do who are in the umbrella of having pre-diabetes or diabetes condition. And the studies have found that people with type 2 diabetes lose more weight through daily fasting periods compared to calorie restriction. So research studies have shown that intermittent fasting works best as compared to calorie restriction in case of people who are having type 2 diabetes. However, before starting a fast, it is important to consult a healthcare professional to learn about any associated risk and complication and create a fasting management plan. So it is very important. If you want to have the intermittent fasting plan, then you should go to a nutritionist and or a physician to know more about how we can manage the diabetes with the help of fasting. So, healthy and nutritious food contains balanced nutritional values and is needed by the body, such as vitamins, minerals, carbohydrate, protein, fiber, and water. These are all important for a healthy lifestyle. So, healthy food is very much needed. A balanced diet is a food that contains carbohydrate, proteins, fats, and vitamins. Now, carbohydrates are needed, but carbohydrate with low glycemic index are preferred. Proteins are good because whenever we are having diabetes, we should focus more on protein, less on carbohydrate. And protein, they give us, because there is a relationship between metabolic processes, carbohydrate metabolism, protein metabolism, and metabolism. They help each other. If one is not available, protein will provide and will make the body to have a glucose, because brain will not survive if glucose is not present. So they help each other in this process. When to see a doctor? If your sugar levels are high or low, if you have wounds that don't heal, if you have pain, numbness, or vision problem, you are pregnant and have diabetes. So get your eyes, feet, and kidneys checked, and once or twice a year this should be done. And regularly check your blood glucose level when you cross 40 plus. Thank you. Thank you all.
Thank you, Professor Dr. Shalini Chahande, madam. It was a very useful subject, and your efforts for preparing the PPT are very great. You have said about the diabetics types, precautions, and what nutritions are effective when we go to the doctor, and what care should be taken, and what are the steps of diabetics. So these are the things, if you keep in our mind, then we can keep away diabetics for few years from us. Thank you, ma'am, for your studious lecture on this. I request all the participants, you can unmute and you can ask your questions related to diabetics and your health. Thank you.
Thanks.
जो उपस्थित दर्शक है
हेलो, नमस्ते मैडम।
नमस्ते सर।
मैडम, मैं तो वैसे लेट जुड़ा हूँ आज कार्यक्रम में, लेकिन एक सवाल पूछ लेता हूँ। डायबिटीज के भी प्रकार होते हैं या एक ही प्रकार की डायबिटीज होती है?
सर 3 प्रकार के डायबिटीज मैंने बताया, टाइप 1, टाइप 2 और जेस्टेशनल डायबिटीज। ऐसे 3 प्रकार के एक और डायबिटीज है जिसको डायबिटीज इंसिपिडस बोला जाता है। लेकिन वो डायबिटीज इंसिपिडस जो हेल्थ केयर प्रोफेशनल्स है या हम बोलेंगे फिजिशियंस है, they are better person to explain that. And we are actually that condition, we don't go, general public don't go, general public go into type 2 diabetes, therefore we are more concerned with type 2 diabetes. तो 3 प्रकार के हैं सर।
तो इनमें सबसे खतरनाक कौन सा नंबर रहता है मैडम?
सर खतरनाक तो सभी है, बट जिसको हम टाल सकते हैं वो है टाइप 2, क्योंकि टाइप 2 ही हमारे हाथ में है और बाकी के जो 2 है वो हमारे हाथ में नहीं है। क्योंकि कुछ जो है वो बॉडी के काम बिगड़ने से ऑटो इम्यून सिस्टम अपनी बॉडी अपने बॉडी की चीजों को पहचानती नहीं है और उसकी वजह से डायबिटीज होता है, तो उसको हम नहीं टाल सकते हैं। दूसरा है जेस्टेशनल डायबिटीज जो कि लेडीज में होता है ड्यूरिंग प्रेगनेंसी, इसको भी हम नहीं टाल सकते हैं। बट टाइप 2 डायबिटीज जो कि तुम्हारे खान पान से और तुम्हारे जो हैबिट से उसकी वजह से होता है, इसको हम टाल सकते हैं। सो उसके लिए हम जरूर कुछ कर सकते हैं, और अगर हम माइंडफुल प्लानिंग करें और माइंडफुल ईटिंग करें तो हम इससे बच सकते हैं।
जी धन्यवाद मैडम।
थैंक यू
धन्यवाद जयवीर सिंह जी। और जो कुछ यहाँ है वो पूछ सकते हैं
सर। अभी सोशल मीडिया पे इतनी इंफॉर्मेशन मिल जाती है कि अभी लोगों को इतना प्रॉब्लम नहीं जाता है कि क्या करना और क्या नहीं करना है।
फिर भी कैसा है, जब हम कुछ सुनते हैं तो सपोर्ट के लिए या कुछ अपनी डिफिकल्टी रहती है वो पूछ सकते हैं, ऐसी कोई बात नहीं।
यस सर, यस सर, यस सर।
लेकिन मैडम सोशल मीडिया में भ्रमित होने के बहुत सारे चांसेस हो गए हैं।
यस सर,
इतना मुश्किल है।
एकदम बराबर है। आपको ये देखने के लिए कि क्या सच है और क्या नहीं है, उतनी इंफॉर्मेशन भी होना जरूरी है कि जो आगे वाला बोल रहा है वो गलत है या सही है, ये भी पता होना जरूरी होता है।
तो आप सभी को धन्यवाद। जी पूछिए।
नमस्ते मैडम।
नमस्ते सर।
आपका बहुत ज्ञानवर्धक सेशन रहा। मैं एक पूछना चाहता हूँ कि ऐसा क्या अपनी जीवनचर्या को सुधारें या किस ढंग से कहें ताकि ऐसी बीमारी से पहले ही आप प्रिवेंशन इज बेटर देन क्योर, मैं उस आशय से क्या हो सकता है उसके लिए पूछ रहा था। धन्यवाद
सर। एक्चुअली जैसे आपने अभी कहा, द सेम क्वेश्चन वाज देयर विथ मी। मेरे घर में मेरी माँ को एट द एज ऑफ 75, शी इज नाउ 83, उनको डायबिटीज 75 प्लस के एज में हुआ। और मेरा जो बड़ा भाई है वो उसको ही इज अ पीडियाट्रिशियन, और उनको डायबिटीज बिकॉज ऑफ हिज लाइफस्टाइल, क्योंकि सर्जन्स को ऑपरेशन में बहुत देर तक अपना ऑपरेशन करते रहे तो खाने पीने में थोड़ा सा डिले हो जाता है, उसकी वजह से, और स्ट्रेस भी रहता है उनको, तो उसकी वजह से उनको भी डायबिटीज हुआ। तो मुझे एक डर मन में बैठा हुआ था कि शायद मुझे भी कभी डायबिटीज हो जाएगा। तो जैसे ही मैंने 50 प्लस क्रॉस किया तो मैंने खुद को एक अलार्म मोड पे लाके रख दिया कि नहीं, अब मुझे खुद को बचाना है इस चीज से, क्योंकि माँ को भी है और भाई को भी है। तो मैंने सर शुगर छोड़ दी कंप्लीटली, चाय पीना कंप्लीटली छोड़ दिया, और मैंने रोटी खाना छोड़ दिया और उसकी जगह पे मिलेट्स खाना चालू कर दिया। और मैंने अपने जो हैबिट्स है, जैसे वेट लॉस करना है तो करना ही है, इतना वेट लॉस करना है, अपने जो टाइमिंग्स है कि हमने कब खाना चाहिए, वो टाइमिंग चाहे कुछ भी हो जाए हमने उसी समय पे खाना है, उसी समय पे सोना है, इतने घंटे की नींद लेना, ये सारी चीजों में मैंने खुद को बहुत अच्छे से मैनेजमेंट में डाल दिया है, सो दैट आई शुड नॉट गेट डायबिटीज। अब ये सब करने के बाद तो मुझे लगता है कि ऐसा कुछ नहीं होगा, बट अब आगे पता नहीं क्या होगा। तो हम ऐसा कर सकते हैं प्रिवेंशन।
बी पॉजिटिव मैडम, हमेशा अपनी आदत है अगर सही रहेगी तो अपने आप जो है स्वास्थ्य अच्छा रहेगा। धन्यवाद मैडम।
यस, थैंक यू।
धन्यवाद सूर्य प्रकाश व्यास जी, आपने क्वेश्चन पूछा है और आपके लिए मार्गदर्शन भी उपलब्ध हुआ। अभी कोई पूछना चाहते हैं तो पूछ सकते हैं। अपनी फीडबैक लिंक इसमें दी वाली है ग्रुप में, ये अपने वेबिनार में, तो आप वो भर दीजिए और उस पर भी आप रिमार्क लिखिए या आपको कुछ क्वेश्चंस है तो वो पूछिए, हम उनको फीडबैक लिंक मैडम को शेयर करेंगे। तो हम यहाँ रुकते हैं आज। थैंक यू मैडम। आज का हेल्थ के रिलेटेड प्रॉब्लम जो थे, डायबिटीज़ ग्रुप से चर्चा हुई और हमें बहुत कुछ अच्छा लगा कि ये हम केयर करें थोड़ा हेल्थ की, तो ये डायबिटीज़ से दूर रह सकते। जैसे अपने खुद के ऊपर प्रयोग किया है, तो सभी ने ऐसा कंट्रोल करके जो कुछ अच्छा बुरा अपने लिए जो है उसके लिए अडॉप्ट करके अपनी चर्चा अगर दिनचर्या अगर बदल के थोड़ा सा अच्छा हेल्थ की केयर के तो डायबिटीज़ से हम दूर रह सकते हैं। धन्यवाद मैडम। फिर कभी आपको
थैंक यू सर।
ये दूसरा टॉपिक कोई शेयर करने की इच्छा है तो हम आपको निमंत्रित करते हैं। धन्यवाद मैडम।
यस, थैंक यू सर, थैंक यू वेरी मच।